Hello everyone, welcome to today's lesson with Nursing Insights with Caleb Mulonga. So today we are going to look at the nursing care plan for HIV and AIDS. So we understand that HIV and AIDS is basically a chronic condition and it is incurable, meaning that it has no cure as of now. So we're going to look at the nursing care plan. And this may depend, it may depend on the scenario that is being given, but here we're going to look at a general for any scenario this can apply. So we first start with assessment, and the assessment that we can have is the first thing is that the patient will complain pain. Therefore, our first problem is chronic pain. Okay, so the nursing diagnosis is chronic pain related to opportunistic infections evidenced by patient verbalization. So you find that these infections that come about as a result of the lowered immunity will result in the patient having chronic pain. So this pain can be in several parts of the body, or it can affect the whole body as it is. And the next one is the goal. So our goal is to relieve pain in the first hour of hospitalization. So this pain should be relieved in the first hour, or you can go as far as 2 hours since it is chronic pain. Then we move to the interventions. The interventions, number one, I will assess the level of pain to determine the interventions to implement. So you have to assess the levels of pain so that you can know what to put up in order to relieve pain. The second one is I will apply a warm compression at the affected part to relieve pain. So you find that you can apply a warm compression at the site where the patient is feeling the pain, and that will help to relieve the tension, therefore relieve pain. Number three, I will use diversional therapy such as television to divert the patient's mind away from pain. So that one is clear. Then the last one is I will administer analgesics such as paracetamol to relieve pain. So there we have our 4 interventions under the chronic pain. Then we move to our evaluation. Our evaluation is patient was relieved of chronic pain within an hour of hospitalization, evidenced by patient's verbalization of absence of pain. So like I have said here, the pain is relieved, and the time frame according to us here is an hour, but it can be 2 hours since it is chronic pain. Then again, we move to the next problem. And our next problem, let's start with our analysis, or the analysis. You find that a patient with HIV and AIDS will have a poor appetite, will have nausea, will also have vomiting. And this is as a result of, number one, the medication that they are taking. It can also be as a result of the pain, and also due to depression. So from that, we can tell that our problem here is imbalanced nutrition less than body requirement. Imbalanced nutrition less than body requirement. So now let's look at our nursing diagnosis. Our nursing diagnosis is imbalanced nutrition less than body requirements related to anorexia, secondary to HIV wasting syndrome and or medication side effects. Of course, you can also put things like depression, but at least here we can see those are the reasons evidenced by weight loss. So this patient with HIV, number one, they have anorexia. Then the lack of appetite is as a result of the medication side effects and also the wasting syndrome. This wasting syndrome is also accompanied by increased demand for nutrients to help or to facilitate the process of viral replication. So that is why the person has less and less nutrients and there will be wasting. Wasting is basically a reduction, a massive reduction in the weight or weight loss. The goal, the nursing goal, is to improve the nutritional status of the patient throughout treatment or hospitalization, to improve the nutritional status of the patient throughout hospitalization. So the goal there is SMART. Always make sure that the goal is SMART. From there, let's look at the interventions. We have a number here, but we just pick 4. So the first one is, I will assess the nutritional status of the patient to evaluate the nutritional needs and identify any deficiencies. So what we want to do here is to assess the nutritional status of the patient to know or to note the nutritional needs and identify any deficiencies. Number 2, I will provide nutritional counseling to offer guidance on a balanced diet and appropriate supplements. So you can offer nutritional counseling or involve a nutritionist to talk to the patient about a balanced diet and proper supplementation. Number 3, I will provide frequent small feedings to minimize anorexia and nausea, therefore promote appetite. So we want to ensure that we give small frequent feeds to the patient so that we can improve their appetite. Number 4, I will encourage the patient to be taking fruits, which are high in vitamins, which will improve the immune system of the patient. So just like that, we have spoken about the nutritional aspect. Of course, we can also talk about foods high in carbohydrates such as sugar to give the patient energy, to provide the patient with energy. Of course, there are others, but those are the ones that we have chosen. The evaluation is patient's normal nutritional status restored throughout hospitalization, evidenced by weight gain. So the patient will gain the weight. Okay. So if you're still struggling with how to write the nursing care plan, there is a video that I posted a couple of weeks ago. You can go and visit that one, then come back to this one. Okay. Then let's go to our third problem, which is you find that a patient with HIV and AIDS will be, some of them, or especially in the beginning, people will have difficulties to believe that they are the ones that are sick or they have this particular ailment. So what they'll want to do is they will go into depression, not that they want to, but because of failing to understand what is happening, they can go into denial, they can go into depression, they can resort to certain behaviors that will endanger them and others. So all that assessment can come up to us understanding that that is what we call ineffective coping. The patient will not be able to cope to the new situation. So our problem is ineffective coping. Okay. So when we talk about ineffective coping, we simply mean the patient is not able to cope or to believe that they are in this particular situation and do what is needed. So the nursing diagnosis is ineffective coping related to the emotional impact of HIV diagnosis and treatment, evidenced by verbalization of inability to cope. So the patient is not able to cope because of the emotional aspect. Okay, they are not able to believe the emotional impact of having HIV. And how will they show this? They can tell, they can say, no, me, I'm not sick. They are verbally saying that they are not able to cope with this situation. Okay. Now we move to the goal. The goal is patient to verbalize his or her feelings more confident about dealing with the situation by the time of discharge. So we want to ensure that the patient is able to say that they are now able to deal with the situation at hand before the discharge. So of course, here you can have any other goal for example, to ensure that the patient is or can effectively cope with the condition throughout hospitalization or by the time of discharge. Okay. So now let's look at the interventions. The first thing that we are going to do is I will set a working relationship with the patient through continuity of care to establish trust and facilitate coping. So basically what this point is saying is that I will create a rapport with the patient to establish trust and help in the coping of the patient so that the patient can feel more comfortable and can be able to cope easily. The second one is I will assist the patient to set realistic goals and identify personal skills and knowledge to cope to the situation. So we want the patient to set realistic goals and identify those personal skills and knowledge that will help them to cope with the situation. Number three, I will encourage the patient to recognize his or her own strengths and abilities to promote awareness. So the third point is just talking about the patient being more aware of their strengths and their abilities. So we want to ensure that this patient has they recognize what they have in them so that they can be able to cope easily to the situation. Number four, I will provide a chance to express concerns, fears, feelings, and expectations to reduce anxiety and open doors for ongoing communication. So we want to create a platform that will help the patient to express their concerns, fears, feelings, and expectations so that we can reduce anxiety and therefore help the patient to cope. Because when the patient is talking, they can easily now they can now have the confidence to at least start coping to the situation that they have. Then lastly, I'll connect with support groups to facilitate access to the peer support and other resources. So I will connect this patient to support groups to access other people that may have been in the situation. Okay, so of course here there are also other points like I will refer the patient to a counselor to give counseling to the patient to help them cope with the situation. So all those are interventions that we can put up. Okay, then we move to the third to the evaluation, which is the patient says he or she feels more confident about dealing with the situation, evidenced by patient verbalizing his strengths and ability to cope. So basically what we are saying here is now the patient will be able to say, I can now deal with what I have. I can now live with the condition that I have without fearing any discrimination. So that is on that particular problem. Move to the next one, which is knowledge deficit or deficient knowledge. So you find that patient will not have enough information about the condition. So that is a problem in nursing. As a nursing problem, we put it as knowledge deficit. So the nursing diagnosis is knowledge deficit related to lack of understanding on HIV and AIDS, treatment and prevention, evidenced by asking too many questions. So you find that the patient will not have enough knowledge about the condition, therefore, they will be asking more and more questions. Okay? The goal is to improve the patient's knowledge about HIV and AIDS. That is the goal about the condition throughout hospitalization. So you have to put throughout hospitalization. Then the nursing interventions, number one, I will explain the disease, the transmission, and the treatment options to the patient to impart knowledge. So you are going to explain the disease process to the patient to impart knowledge. Number two, I will allow the patient to ask questions and I'll answer them accordingly to increase the knowledge levels of the condition or about the condition and to allay anxiety. Number three, I will explain to the patient about the medication regime, including the names of the drugs or medication, the dosage, the reasons for taking, and the side effects to increase the knowledge about the treatment. So you are going to explain to the patient about the medication or the medical regimen or regime that they are going to be on. And lastly, I will ask the patient to explain in his or her own words to determine the patient's understanding. So I will ask the patient to now explain the condition the way they've understood it in their own words. And this will help us to understand if the patient has actually understood. Then the evaluation. Patient shows good level of knowledge about HIV condition, HIV and AIDS condition, evidenced by patient asking too many questions about evidenced by patient answering questions about the condition. So the patient will now answer those questions if they're asked, or it can be evidenced by the patient actually explaining. Okay, the patient actually explaining the condition. Okay, so those are the ones that we have. And of course, we have fatigue as another problem. So you can put fatigue or activity intolerance. In that case, those two can be side by side, but we've chosen fatigue because in particular, these people will be mostly tired. So fatigue can be put as a nursing problem. Okay, so fatigue, and then fatigue related to the decreased metabolic rate and increased energy demand, evidenced by reports of lack of energy and inability to maintain usual routine. So you find that the patient will be tired. or will be feeling tired more and more. And this is because they have a decreased metabolic rate and an increased energy demand. So whatever energy is being produced in the body, it is going towards the viral replication. So you find that the patient will be tired most of the time. And this is evidenced by the patient actually saying that then they do not have energy or they feel weak, and due to the inability to maintain usual routines. Then the goal to improve the energy levels in participation in desired activities after 24 hours of hospitalization. So what we want to do is to improve the energy levels, okay, to improve the energy levels of this patient after 24 hours of hospitalization, or it can be 72 hours or 48, because when the patient is tired, you don't expect them in few hours to feel energetic again. So it can be some extended period. In this case, we have put 24 hours. So now let's look at the interventions. Number one, I will assess the sleeping pattern, and other factors that may contribute to fatigue. I will assess the sleeping pattern and other factors that may contribute to fatigue. And the rationale for that is to understand and improve, to understand and also to identify the reasons why the person is having the reasons why the person is tired. Okay, so basically this point is trying to make us know or understand why the person is being fatigued. So you are going to assess the sleeping pattern and other factors such as the emotional state of the patient. Okay, that's the first one. The second one is I will ensure that the room is quiet to promote rest and sleep. So that one is straightforward. Number three, I will assist the patient with setting priorities for preferred activities to conserve energy. So since this patient, like we have said, since this patient is feeling tired, so what we will do is set priorities. They should not just be doing anything. You should set priorities or those activities that are needed at that particular moment. That's the only ones that they have to do so that they can conserve energy. Number three, I'll promote intake of food high in carbohydrates to provide energy. So we understand that the patient is energy depleted. So it's better we give them foods that are rich in carbohydrates to provide energy. And lastly, I encourage the patients to refrain from performing non-essential activities to save energy. So this one, again, we are telling the patient to stop or to stay away from activities that are non-essential so that they can save energy. So this point, together with the point that I said, I will assist the patient in setting priorities for preferred activities to conserve energy are alike. So these two are alike, okay? So those are the interventions. So remember, whatever intervention you come up with should have a rationale. Then we go to the evaluation. The evaluation, the patient's energy levels and participation in desired activities have improved, evidenced by reports of increased energy and ability to perform daily routines. Okay, so those that is the evaluation, and that is the all about our nursing care plan. So we've identified 5 problems. Of course, we have left out quite a number, and in an HIV patient, we understand that almost all problems can apply. So you can have problems such as um, risk for infection because the immunity is low. You can have altered thermoregulation because of further infections that the patient may have. You can have um, um, fluid volume deficit because of diarrhea. Okay, so all those things can apply in this patient, but we've just chosen these ones. So in your own time, find different problems and try and write about them. Okay, so that you can understand more about the HIV nursing care plan. So if you have any questions, you can comment in the comment section and I will be able to attend to them. So thank you for taking time and listening, and I hope you have learned all that you had to learn about the nursing care plan for HIV and AIDS. Thank you. See you next time.